Good day, and thank you for joining us for another edition of Conversations with AARP in the Virgin Islands. I'm Troy Deshabir-Schuster, State Director for AARP in this territory. Today, we are pleased to bring you another episode regarding Medicare, taking a more in-depth look at the Virgin Islands State Health Insurance Program, also known as VI-SHIP, the local Medicare source provider. This series is dedicated to unraveling the complexities of Medicare and making this information accessible to everyone. We recently covered the basics of Medicare, exploring its various parts and what they mean for you. Today, we're taking a step further. We will explore lesser-known aspects of Medicare, including the recent changes, tips for navigating the system, and how to make the most out of your benefits. This episode is designed with everyone in mind. Whether you're an existing beneficiary approaching eligibility, or you're a caregiver assisting a loved one with managing their healthcare. The information shared today will help you understand the plan that best suits your healthcare needs. We're also delighted to welcome back our guest, Shani Amory. As the director of the Virgin Islands State Health Insurance Program, VI-SHIP, her understanding of Medicare benefits is invaluable. Together with Director Amory, you will gain a clearer understanding into navigating your healthcare journey and making the most of your Medicare benefits. And so we welcome Shani Amory, the director of the VI-SHIP. Good day, Shani.
Hi, good day, Troy.
Thanks for being with us again. And we have so many more interesting topics or subtopics of Medicare to cover. So first of all, give us a brief overview again of what your office does, VI-SHIP.
Okay, so the VI-SHIP stands for the Virgin Islands State Health Insurance Assistance Program. We are the local Medicare source for Medicare beneficiaries, their family members, and their caregivers here in the Virgin Islands. We are a federally funded program, and we're locally administered by the Lieutenant Governor's office.
Great. And last time we went over the various parts of Medicare. We don't want to get too much into detail with that in this episode, but if you will, tell us about Part A, Part B, Part D, Part C, just very briefly.
Okay, so original Medicare has two parts. Medicare Part A, which will be for inpatient hospital stays, hospice, and also some home health care. And Part B is for medical doctor visits and also for procedures and such as lab work and other medical procedures that are covered by Medicare.
And then, so that's Part A and Part B, and then Part D.
So Part D is the drug prescription plan that's available for Medicare beneficiaries, and that is sold by a private insurance that works with Medicare to sell prescription plans. And then there's also the Medigap policies, also known as Medicare supplement plans. And those work by supplementing the Medicare Part A and Part B. In addition to that, there are also the Part C plans, which are Medicare Advantage plans. And through Medicare Advantage plans, beneficiaries are able to they're able to get the coverage from original Medicare, which is the Part A and the Part B. And in addition to that, they'll have additional perks such as dental and vision.
So, in review from a recent episode, the Part C, which is the Advantage Plan, that is only available to government retirees, but the other supplemental plan is available to anybody, whether a government retiree or not. Can you just give us a little more detail regarding that?
Yes, so original Medicare nationwide is typically the Part A and the Part B, and that is available to all Medicare beneficiaries throughout the United States. The Medicare Part C plans, those are sold by private insurance companies. And here in the Virgin Islands, the only Medicare Part C plan is available for GVI retirees from the Department of Personnel. So that was the plan that they created specifically for their government retirees.
So for non-government retirees, then what is the supplemental plan that's available?
So there are still options for non-governmental retirees. They can pick up the Part D plan. They can also pick up a supplement plan. And the supplement plans, those plans work by assisting Medicare beneficiaries in covering their copays. So after Medicare pays for the 80% of the cost for an approved service, the supplement plans will assist the beneficiary in the co-payments and the co-insurances for that remaining 20%. And it will also cover if there are any additional doctor fees, it will cover that also, depending on what plan the beneficiary signs up for. And what Medicare supplement plan the beneficiary signs up for, it can also cover the deductible for the Part B. So that means that the Medicare plan will immediately cover the Part B deductible, and there will be no need for the beneficiary to pay that before they can enjoy the benefits of having the co-pays and the co-insurances covered through the plan.
Very good. Now, for our audience, we've raced through a lot of information here regarding Medicare. We want to get into some other topics that we didn't cover in a recent episode. So now we're just giving you an overview at the beginning. If you want to learn more about these plans in detail, then please do visit our AARP Virgin Islands YouTube channel. You can find the episode there. That was the episode of last week. Um, Oh my goodness. I should have had that date right up here. I will get that to you before the end of the show, but you can look it up. That was actually on November 21st. You can look up that episode. You can find it also on our AARP Virgin Islands Facebook page. Today, we're going a little bit deeper into Medicare. There's a lot of information. Our show is only 1/2 hour. I wish we could have had more time to get into all of the detail all in one episode, but you can refer back to the November 21st episode, both on Facebook and on YouTube, and find that program. And so now, Shani, again in review, tell us about the enrollment periods, open enrollment, and what that is all about, and also when somebody should initially enroll for Medicare, and about the penalty if you don't enroll when you should enroll.
Okay, so let's begin with the Medicare initial enrollment period. This is the period when a person turns 65 and they're able to join Medicare. So this is a 7-month period. It begins 3 months before the beneficiary's 65th birthday. It includes the month when the beneficiary turns 65, and then also includes 3 months after the beneficiary turns 65. So let's say a beneficiary makes turn 65 in the month of April. Their initial enrollment period will begin from the month of January, and then it will be 3 months after the month of April, and so it will end in July. Okay, so during this is the time for beneficiaries to contact Social Security and to sign up for their Medicare enrollment. During this time, they can choose whether they want to pick up only the Part A or the Part B, or they can choose to pick up both parts during their initial enrollment period.
Okay, and then open enrollment. What is that about, and when does that happen?
Okay, so open enrollment that runs every year from October 15th until December 7th. And this is the time for Medicare beneficiaries who do not have the Part D prescription drug plan. This is the time for beneficiaries to join the plan. So the deadline to do so is next week. To do so, VI ship, we can assist with that Part D sign up. And this is an important time for beneficiaries who miss signing up for Part D during that initial enrollment period that we just spoke about. Now is the time for them to join the Part D plan. So we strongly encourage beneficiaries during this time they don't have the plan to pick it up and to do so to avoid any late enrollment penalties that will occur for every month that a beneficiary goes uncovered without any creditable insurance coverage that provides coverage for prescriptions.
And I'm correct in saying, am I, that these penalties for late enrollment carry on for the life of the beneficiary, correct?
For the duration of the plan, they will have that late enrollment penalty. That is correct. So typically, it will be about 3% of the average cost for the Part D prescription plan nationwide. So it can be about 30 cents per month.
Okay,
An
so
additional, so it'll be, I'm sorry, let me rephrase that to make that clearer. It would be 30 cents for about 30 cents for every month uncovered, and then that will be added on to the monthly premium payment for the Part D plan for the duration of the plan.
yeah, so it's very important to enroll on time. Please don't be late. Now, let's talk about some of the recent changes to Medicare, particularly those related to the lowering of medication costs following the enactment of the Inflation Reduction Act of 2022, which AARP successfully advocated for on Capitol Hill and at the White House.
Okay, so through the Inflation Reduction Act, President Biden delivered on his promise to provide millions of Americans with affordable health care, and this includes the cost for their prescriptions. And this would be for all 50s and also including all territories, especially here in the Virgin Islands as well.
Okay. Now, there are lots and lots of other changes and lots of other information you want to give. So I'm just going to, in a manner of speaking, hand you an open mic. So you share with us what you would like to share from your office and your position as a director of VI-SHIP.
Okay, well, I guess we can just briefly run through how the Inflation Act is going, how the changes are going to occur. So we're
Yes.
going to see changes every year between now and 2029. So for 2023, we saw where there was an insulin benefit for Medicare beneficiaries who are enrolled in the Part D plan. They will pay no more than $35 per month for their insulin coverage. Okay. And then if we then go on to 2024 and 2025, we will continue to see the cost for prescriptions drop because Congress is working with drug companies to lower the cost for prescriptions. One of the one thing that I did saw that really, impressed me with the act was that beginning in 2025, there's going to be a cap on the amount of there's going to be a $2,000 cap on the amount that beneficiaries pay out of pocket for their prescriptions. So I do want beneficiaries to just stay tuned for those changes that are going to occur throughout the years in regards to their in regards to their prescription drug costs.
Okay, so that's a lot of good information and lots of savings for prescriptions for Medicare beneficiaries. And again, at AARP, we're proud to say that our national colleagues, we are the ones who advocated for this on Capitol Hill and at the White House. And so, as we have said in all of our communications with our members across the country, that AARP was advocating for a reduction in the costs of prescriptions. And so we've been successful in that, and those savings will be rolling out over the next few years. So Medicare beneficiaries can expect to receive those benefits. And so, Shani, what else is happening regarding Medicare and in your office?
So, here in our office, a part of our efforts is that we conduct outreach events throughout the year. So, of course, during the pandemic, to protect our vulnerable population, the beneficiaries who are typically 65 years and older, we held off on the outreach events. We weren't even serving beneficiaries in person, but right now and we are beginning to do our events on a monthly, well, we are doing them now on a monthly basis. So, outside of that, you will see VI ship at local events such as during Carnival and also on St. Croix during the agricultural fair as well. And right now, you can catch us on a monthly basis at UVI on both St. Thomas and on St. Croix. And right now, we are doing monthly events to educate beneficiaries, family members, caregivers about Medicare, their Medicare coverage, what are their Medicare options, how VI Ship can assist you all with the enrollment process, how we can assist beneficiaries with submitting appeals. Let's say they have something where they have a notice from Medicare saying that Medicare did not saying that a claim was denied. We can assist beneficiaries jumping on the phone to figure out what was the reason for the denial and how it can be resolved. During these outreach events, it is good to get one on one. We've had about four so far. And when the beneficiaries come, they bring their paperwork, they bring everything so that we can actually sit with them face to face and go over whatever paperwork they have that may be confusing to them. Medicare is a maze, and VI Ship is here to help you all navigate that maze. One amazing thing about these outreach events right now that we are doing is we are actually bringing on mental health professionals to come on and speak about aging, speak about the emotions that come along with aging, speak about anxiety that may occur, depression that may occur, the trauma from the hurricanes, the trauma from COVID. Just speak about the grief that may occur with aging, and not just with someone passing on, but just with how, let's say, a person or a spouse develops dementia, and the grief of the loss of that relationship because the personality has now changed. We're going to be doing events on caregiver burnout. Right now, we have a lot of beneficiaries who are aging. So, a lot of caregivers now, they're 65 and they're still caring for their elderly parents who may be in their 80s who are also on Medicare also. And we have the events for December that are scheduled already. We have St. Croix next week, Wednesday. That's going to be at UVI Great Hall, and we're going to have Dr. Constantine. She will be the professional speaking there. She will also be here on St. Thomas on next week, Thursday. And then December 18th, we have Miss Nisha Charles who will speak. And during this event, they're going to focus primarily on holiday blues and navigating that, and how to also develop a healthier outlook for 2024. So we are very excited to be out and about. These sessions are free, 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 free. Okay, so once you are a caregiver, a family member, a Medicare beneficiary, feel free to reach out to us to sign up, and it's amazing. The feedback from the beneficiaries, they are excited to have these conversations. We always hear in the Caribbean how mental health is not something easy to speak about, but I can say the feedback from our beneficiaries during these sessions, they are eager to have these conversations about their emotions, about how they're feeling, about how they deal with stress. They share their experiences, and it's a safe place. And then we have someone there, right there, a professional who's able to help them navigate these discussions. And we also brought on professionals who work in institutions that accept Medicare. So after these sessions, beneficiaries are actually saying, "How do I get in contact with you?" And we also then educate the beneficiaries about their Medicare mental health benefits that are available to them.
All excellent, excellent information. And thanks so much for all the great work that you and your office are doing regarding Medicare and all of this outreach. You mentioned some moments ago that Medicare is a maze and that VI Ship is there to help us to figure it all out. And I so greatly appreciate that. I just want to remind our audience that AARP is not an insurance company. People are always calling us and coming to our office asking about Medicare and other insurance products. AARP is not an insurance company. We do not sell insurance products. We're not insurance experts. And so every time somebody comes to us asking about anything about Medicare, we refer them to your office, to VI Ship. And you and your staff are always extremely helpful. So We want everybody to just be reminded again, if you have a question about Medicare, please do contact the VI SHIP office. Shani, tell us where your offices are located and the phone numbers.
So on St. Croix, we're located at Wang F. Louis Hospital. That number is 773-6449. The extensions are 3151 and 3152. Over here on St. Thomas, we are located in Niski Center on the outer part where immigration used to be. Our number at this office is 774-2991 extension. My extension is 4507. So y'all can give me a call directly at extension 4507.
Well, great. Ladies and gentlemen, you've heard it directly from the director. You can even call her and get help. And I can attest to the fact that she is helpful because I've sent some people directly to her and she always takes the call and is always very helpful and they always have a good resolution. So, again, please, if you have any questions about Medicare, don't come to the AARP office. If you want to come and find out the great advocacy and community outreach work that we're doing in the Virgin Islands, you're more than welcome. Please do visit our office. Right now, we're in between offices. We're just in a temporary space and mostly working from home until we get our new office in Sunny Isle Shopping Center. We're working on finalizing those plans. But you can always look us up on Facebook and on the internet and find more information about the work that we do at AARP Virgin Islands on Facebook, and aarp.org/VI is our website landing page. And but again, if you have any questions about Medicare, please do visit the VI SHIP office on St. Croix or St. Thomas or give them a call. And Shani, what else do you want to share with us about Medicare and the great work that you're doing?
Well, I guess we can speak about misconceptions with Medicare in our SHIP office. So people contact the SHIP office, and of course, they're asking about these Medicare Advantage commercials that are running every day, every minute on television right now. And they're saying that when they call the number on the commercial, they're being told that they aren't eligible or that the plans are not available here in the Virgin Islands. So I guess this does go back to when we spoke earlier about the different parts of Medicare. But I do want locally our listeners and to please share this. I want you all to understand that it is not Medicare itself that is selling these Medicare Advantage plans. A lot of people feel as if they're being unjustly, treated here in the VI by not having a Medicare Advantage plan available from Medicare. But the Medicare Part C plans, those are private insurance companies. And although they are partnering with Medicare to sell these plans, it is solely the company's decision as to where they want to sell the plans. So when you all do call, they're going to tell you all that there are no plans available. That is not Medicare itself. That is a rep from the company telling you that their company is not extending their coverage here to the Virgin Islands. So please don't feel that that Medicare itself is not extending certain parts to the Virgin Islands. Like we said before, original Medicare is the same nationwide and here in the Virgin Islands. You have the Medicare Part A, the Part B, the Part D, and there are also supplement plans that are available as well too. So I do really, really want our listeners and our beneficiaries and family members and caregivers to understand that those are private plans that are selling the Medicare Part C plans, and it is solely their decision as to where they want to sell these plans.
I'm glad you brought that up because I've actually heard some stories of people here becoming members of some of those advantage plans, somehow getting through and becoming a member, and then it doesn't work here, or they don't need it here, or both, right? And then they have a hard time canceling the plan. I've heard other stories of people who are living on the US mainland who end up calling up all these different numbers that they see on television and they end up enrolling in multiple advantage plans.
Yes.
sometimes four and five different Advantage plans, and all they really need is one.
All they really need is one. And
Yeah.
that is a very good point, Troy, because people may say, oh, well, I can use my child's address who lives in this state. And they may think, okay, this is the loophole. So they may think, okay, well, I now have a Part C plan. What happens is that your Part C, when a beneficiary joins a Part C plan, it replaces the original Medicare. So now here in the VI, when they have to go to their doctor, it's not going to work. And so they have lost the original Medicare. So they cannot have both original Medicare and also the Part C plan at the same time.
Yes, very good. I'm very, very glad we're talking about this because that is a point of confusion for a lot of people, especially older people who may not understand all these nuances and they're seeing this on television and thinking that they need it. And they're getting it with the very best of intentions, but they end up running into other problems. So please do be aware of that. Again, for our audience, you can look back at a previous episode, which was recorded on November 21st, and you can find that episode on AARP Virgin Islands YouTube channel as well as WTJX YouTube channel, also on AARP Virgin Islands Facebook page. Again, that was a November 21st episode. You can look up that date and find that episode and find a lot more detailed information on the various Medicare plans or the different parts of Medicare, if you will. And again, in this show, we're just going a little bit deeper into various types of information regarding benefits and regarding some of the pitfalls and loopholes and so forth that one should be aware of. And again, please do feel free to call the VI ship office if you have any questions about Medicare and your benefits. And so Shani, what about on the internet? Do you have a Facebook page or a website that you can let people know about for the VI ship office?
So currently, our Facebook page is not running right now. However, Lieutenant Governor's website does have information about our program, lgo.vi.gov. I do believe that is the website. I'm not 100% sure. I'm so sorry. But give us a call and we can definitely, there we are. Yes, ltg.gov.vi.gov. That is the website where you all can log on to not only see about VI, but also other divisions under Lieutenant Governor's office as well too. And then you all can give us a call and also go on to medicare.gov. A lot of information on there as well too in regards to benefits and coverage. Medicare.gov.
Excellent, excellent. Thank you so much. And all of the wonderful outreach programs. So please do look that up and take advantage of it. So today, again, Troy Deshabir Schuster, State Director of AARP in the Virgin Islands, speaking with Shani Amory, the Director of the VI Ship Office here in the Virgin Islands, bringing lots of important information about Medicare. So we're so very pleased, Shani, to have you in this program. We look forward to having you with us in a future episode.
Looking forward. Thank you for having us.
Thank you. Have a great day.
You did the same as well.
Thank you.